Good morning. Today we are going to look at the technique of laparoscopic bariatric surgeries which are commonly done. There are almost 19 different types of operations done, and out of this, 3 operations are most common in India. One of them is laparoscopic sleeve gastric tummy. So when we are looking at the operation, I will give you the understanding about how the anatomy of an individual is and how we change it. In this operation, laparoscopically, we enter the abdominal cavity with long pen-like instruments which have got functional tips. These operations are done in a position of a patient which is little bit slanting, almost up to 40 to 60 degrees head high. Once we enter the abdominal cavity, the complete abdominal cavity is inspected to understand the anatomy and if any abnormalities are present. Usually, the stomach of an individual is nearly between 700 cc's to 1.5 liters capacity. In the sleeve gastric tummy, a part of the stomach which is near the greater curvature of the stomach is removed from the body. This operation is done using the staplers. Staplers are the typical machines which staple both the sides of the bag and then we cut in between. When the staplers are used, the system gets sealed first and then the cuts are made. During this operation, a lot of safety measures are taken so that there is no leakage from this operation. After the operation is done, the patient's capacity of eating food goes down, but that is something which is essential for living, and the purpose of the operation is particularly to remove a part of the stomach which is producing ghrelin in abnormal excess amounts. Ghrelin is the secretion largely from the greater curvature of the stomach, which has got a strong anti-insulin property. So particularly, ghrelin doesn't allow the insulin to work well and creates a resistance between the calorie and the tissue. Automatically, the tissue is starving and the calorie gets stored in terms of fat and later on with sugars. This is how the calorie is deprived of the entry into the tissue, and the tissue is deprived of the energy which is provided by the calorie. This imbalance gets corrected once the ghrelin levels are got down after the operation of sleeve gastrectomy is done. This is one of the very simple and most popular operation which is applicable in Indian scenario to a great extent because it has got anti-obesity as well as anti-diabetic property. Particularly in kids at the geriatric age, that is old age, in patients who are willing to go for pregnancy later on in their life, this operation is one of the most preferred operations.